We're not just a healthcare organization. We're an organization that wants to create a sustainable health system, not a healthcare system. We're thinking about prevention strategies. We're thinking about wellness strategies in communities. We're thinking about populations. We're thinking about outstanding science around the study of populations and people.
I found exactly what I wanted at Dartmouth-Hitchcock. It offered me the opportunity to have a great clinical practice, and it also offered me the opportunity to become involved in the community in looking at quality care delivery for our patients.
My view of what 1DH is that a patient, wherever they go, whether it's at the academic medical center or in a community practice, whether it's seen by a specialist or primary care doctor, will have the same kind of experience around safety, quality, and service.
Even though I'm 90 miles away from Dartmouth-Hitchcock Medical Center, the major academic center up in Lebanon, New Hampshire, I feel like they're in my backyard. I have direct access to all the specialists and subspecialists up there. So if I'm looking at a case that I need a second opinion on, I oftentimes will pick up the phone and call up my friends up in Lebanon and ask them, what do you think about this case? So the patients, even though they might be seen in a community group practice somewhat removed from the major academic center, they benefit from having that specialty and subspecialty care as if it's in their backyard.
There are resources that the tertiary care medical center has that we can share in as a community center, which allows us to provide homegrown, high-quality medical care for all of our patients, even in the smaller communities.
I really feel like everybody's on par with each other, mainly because the specialists understand that we refer to them and it's important for them to have a good relationship with us. And at the same time, we depend on our specialists for their expertise. So it's extremely collegial. I'm actually very, very happy with that here.
Being affiliated with a teaching institution, it's part of what attracted me to this practice. Teaching medical students and residents challenges me to stay on top of my game.
Dartmouth-Hitchcock is run by physicians for the most part, all the way up to the top. My boss is a physician, his boss is a physician, all the way up. So when I'm talking to people about my job and what I need to do my job better, they know what it's like to be a doctor. I'm not talking to someone who's always been an administrator.
They discovered that she had. I like the spirit of camaraderie, that we really work as a team. So everyone is critical and crucial in the delivery of the care, that we do not create barriers or separations between the layers of the team members, that we treat each other with respect.
Well, sounds like you're pretty stable since being home.
I think the special thing about working for Dartmouth-Hitchcock is the opportunity for balance. There's a lot of opportunities to seek out your interests. At the same time, I think they're very conscious that doctors are human and that they do encourage family life and activities outside of medicine.
And then there's a stenosis here that I'm a little bit worried about.
We have assets and tools here that few organizations could possibly match. It's not buildings, it's not new devices, it's not technologies, it's the people. When you put the people shoulder to shoulder, Dartmouth-Hitchcock will stand up with any organization in the country.